Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
And one that just jumps right out at me that Diane is saying, do you believe that a person with ASD can recover? And I'm gonna unloose Dr. Grand-Pichet on this, but I just want to say for anybody who's having an immediate allergic reaction to the word recover, Dr. Grand-Pichet will talk to you about, because I think different people have a different idea of what that means, Dr. Grand-Pichet. So maybe we start there.
Yeah, sure. And thank you, Diane, for asking that question. I would recommend that you, and I will get to discussing the word recover, but I would suggest that you take a look at a video a film that I made a few years ago called Recovered: Journeys on the Autism Spectrum and Back. So that tells you that I hear an echo. I'm not sure if...
Oh, it might be me. Let me turn down my, it might be me.
Okay, so I am not sure if there are, I know that there's a lot of people who have concerns about the word recover, and I just want to kind of clarify my position on that. I don't think of autism as something bad that you need to be taken away from. I think that it is like any other disorder. It is something that is debilitating enough for some people that they themselves or their parents or guardians would like them to overcome some of the symptoms that act as obstacles in life, so that the individual can interact socially and engage with all the wonderful reinforcers that are available in life. So, I know there are people who are sort of feel like recover. Why would I, that's a bad word. And why do you want to force people to be what they're not? And there's nothing about forcing people when we talk about recovery. It's about people coming to us and saying, hey, I just need to learn to talk better. I need to learn to socialize better. I need to learn to take care of myself and hygiene and safety better. Or parents coming and saying, like you guys, my child can't sleep. My child needs potty training. My child needs whatever it is. And us working towards teaching those specific skills. And once the individual, the child, learns enough skills, they no longer have enough symptoms to qualify for a diagnosis. So, and that's essentially happens with a lot of our kids, is just you look at it not as a term or a label, but and especially autism. Autism is such a huge spectrum. It's really about looking at just the skills that are not that are holding the individual back, right? The lack of skills that are holding the individual back. And there's so many examples of this. Like, we want our kids to be able to have friends, as an example. So if their social behavior is not acceptable by peers, we want to teach the child how to interact with peers in a way that they can get friends. That's just one example. If a child is frustrated because they can't express what they want verbally, we try to teach them how to express it, either verbally or non-verbally, but to be able to communicate with the world. So the things that we teach are skills that help the individual interact, communicate, have their needs met, socialize, gain reinforcers from their social environment, and all of those types of skills end up, in the end, removing the diagnosis, because the child no longer has those deficits that are part of the diagnostic criteria.
Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.